All right, so now getting into the questions from you all here. Uh, this one has been interesting, especially as I've been out, whether doing the groceries or delivering groceries on behalf of vulnerable people. When should I wear a mask? This is a question people are kind of struggling with. I know this is one of information, which there is information coming from the federal government, but I don't know that it is as clear as it could possibly be. And so I'll add my own piece, not just when should I wear a mask, but to what end does a mask serve a purpose? And what are the differences between masks when we're talking about something that you can make at home versus what you might have in a hospital?
Who wants to take this one?
As I said, it's hard to jump in with an answer when you have expertise sitting right there from infectious disease, especially, to give us the straight answer, because that's usually the one I go to for a question to clarify. So I defer to you, Priya.
Okay.
Please.
So I think that the short answer to that question is whenever possible. So wearing a mask does prevent you from transmitting the infection to other people. That's the primary goal of wearing the mask. It may play a small role in preventing you from getting infected, but really your wearing a mask is a public service to everyone else around you. And I think that if you're going to the store, if you're going anywhere into a building, you should be wearing a mask all the time. If you're out for a walk and you're not likely to run into any people, you're out on a trail of some sort and you can keep your distance from other people, maybe it's okay not to wear a mask, but all the rest of the time you should wear a mask. That's the answer. So what kind of masks? So there's definitely differences in how effective surgical masks are. They're definitely better than cloth masks, but they are in very short supply. So I still would recommend leaving that for the healthcare workers. A cloth mask, if you can find one or make one yourself, is what you should be wearing when you go out as a member of the public.
Great. Anyone else, or Liz in particular, from the education standpoint about wearing masks? I've seen some people, they're not the most comfortable things in the world at times. Any tips on how to make that a more routine part of life?
Yeah, so I agree with everything Dr. Sampath Kumar said. And I don't know that I have too much else to add with that other than, there are different kinds. And so for the cloth masks to be worn in public, some that go behind the ears, some that tie in the back, I see from nurses who, are wearing masks for hours and hours on end. Sometimes the back of the ears will, get irritated with that. And so there's lots of creative ways to keep that from happening, and tied in the back and buttons on headbands and those types of things. But I would just echo that it can be uncomfortable, and it's not maybe what anybody wants to do, but it is keeping each other safe and what we need to do for that. And it's a message, as was described, it's more to keep other people safe than maybe necessarily you safe for those of us just out in the community. It's also a message that says, I care about you. When you see somebody in a mask, they're trying to keep others safe. And so I think it's helpful to look at it in that way.
And actually that point that Liz just made, I just underline it. And so we look to our history of our greatest generation and what they faced, and how as a country folks came together and did whatever they could in whatever way to do their part. It's been described that this is our war, and I'm not going to debate the rhetoric of it, except to say that we're all in this together. And I think Liz's point right there of this is a way in which we show that we're in this together, that we care for our neighbor. There's no more effective way to show this than saying, I'm going to do whatever I can, even if it is this small part, to try and help keep you safe. And as Dr. Sampath Kumar alluded to, this is a long thing that we're going to go through. Dr. Walls has said this is a winter, not a blizzard or a snowstorm. Dr. Osterholm said this is the second inning of the game. So we're all in this together, and that's the ethos I just underlined.
I can't help but think about how much when I was in the Army, there was a lot of things we had to wear that were not great. And there was very much, it's comes from the idea of your personal, the same acronym, personal protective equipment. It comes from the idea of protecting yourself. But out there, there's very much the idea that everyone wearing it allows for the idea that you being hurt on the battlefield impacts everyone. And there is a collective piece here. So there's that idea that you are protecting others is such an important one to remember. If you're looking for tips, I mailed to a friend who's good at sewing. I mailed off my 2019 Minnesota Twins Homer hanky because it didn't get much use. And I want to remember fonder things like baseball coming back. So, you know, the material, it doesn't have to be that grade, the clinical grade, to be able to have that impact of keeping other people safe along the way too.